Hi, everyone, and welcome back to Frontlines of Future Care. I'm Samira, and today I have the pleasure of being joined by Dr. Carolyn Ward. Carolyn started her career as a primary care doctor and later moved into health tech, working at companies like Forward, Row, and Particle Health, to help build tools that make healthcare better for both doctors and patients. She brings a mix of medical experience and product thinking, and we are so excited to have her on today. Carolyn, thank you so much for being here.
Thank you for having me.
All right, so let's start with a little bit of context for our audience. You work at the intersection of data, AI, product strategy, health equity. What does that actually look like in your day-to-day life?
That's a great question. I would say a lot of what I do today is really focused on how you can take clinical first principles on how you help patients to access care, get high quality care, deliver that care, and how you translate those clinical principles into build principles. So when you're thinking about launching new products, new services, new features, what are the markers that you want to set as guardrails for both efficacy, for safety? And so a lot of what I do is kind of very cross-functional. I end up spending a lot of my time talking to cross-functional stakeholders across business, growth, product, to try to deliver the highest quality of care for the most amount of people possible.
Yeah, that's a lot. So yeah, you kind of bring that perspective of having worked on the doctor side of things. How has your experience as a doctor kind of shaped the way you build products for the patients?
Yeah, that's also a great question. I would say one, obviously, is kind of like the foundational clinical
Hmm.
expertise, right, of the medical knowledge. But I would say even more than that, there's kind of like two main things I think has really helped me to drive a lot of product builds. And the first one is the perspective of the physician or the clinician to begin
Hmm.
with. So, for example, understanding like a lot of the manual workarounds, like what are the pain points, what is likely to be integrated into workflows versus what is not, right? So
Hmm.
really understanding like how the health system works and how people work within the health system, which
Okay.
often is like jumping through hoops, finding their own band-aid hack together solutions that you would think like there is no way somebody is doing this, but like
Mhm.
actually people rely on that every single day,
Yeah.
including like taking notes on post-its, for example, right?
Okay, wow.
And then the flip side of that is like understanding the patient journey and understanding like what are the pain points that we see patients having, whether it's to access care or stick with care, um, and like what I have seen to be effective in my medical practice of like speaking to patients, what resonates with patients. And so I use a lot of both of those perspectives to try to inform different products.
Yeah, I think that's really valuable. When you're building these tools and trying to get it into real clinical environments, I mean, I'm sure there's so much good that comes along with it, but I kind of have to ask because there's a lot of question around digital being used in like real patient care. Are there any challenges that come along with this, or how does that work for you?
Oh, definitely. I would say it has to do with like telehealth or digital care or digital products being integrated into healthcare can mean a lot of different things, right? Like we're
Hmm.
talking about, is this a provider facing application that sits on top of your EHR? Is it totally separate? Is it a diagnostic piece of equipment that incorporates some kind of digital AI? Is it a patient facing app? Like I think there's so many ways that
Hmm.
we are applying digital technology into healthcare. It's really hard to say, but I would say main challenges that I have seen, maybe more high level, is like, does it integrate into the current workflow? I
Hmm.
think this is a really big challenge, especially for digital tools for providers specifically, because many of these workflows are so manual
Right.
that the upfront capital in manpower and change management that you would need to make a switch over to integrating a digital tool is usually the bar is so high that it's very hard for people to overcome that. So
Hmm.
even if your company or your organization buys a certain digital tool, we have seen time and time again that in many cases there's like almost no adoption. And that's because even if it is like more manual, even if it's not as good, the current systems in place are just so ingrained that
Yeah, it's hard to
your
go
tool
back.
has to be exactly, your tool has to
Yeah.
be like 10x better for it
Right.
to be adopted.
So do you find a lot of the time you just end up not using that product because it's too much to integrate it, or how do you go about passing that little block?
Yeah, I think it has a lot to do with how your product was originally created. I think companies that incorporate physician feedback early on in their cycle and really understand like why a manual flow is in place to begin with,
Mm-hmm.
and can deeply understand like what is the problem that manual workflow is there to solve? Can we solve that better? And what are the pain points in that manual workflow?
Mm-hmm.
Those are the products I think are have the best chance
For
of
growth.
like driving adoption because you're really understanding who your end user is.
Yeah.
And that's true across all digital products,
Yeah,
right?
yeah,
Not just for physicians.
yeah. Yeah, that makes sense. So shifting back over, what do you think is actually
I
working?
mean, I think it also probably has to do with like what aspect that you're really driving towards, right? So, for example, we see a lot of AI and other digital tools happening in multiple different sectors in healthcare and health delivery. So, you think about what I consider kind of like logistics, operations, care coordination, right?
Hmm.
So, that could be from like AI scheduling bots all the way to like care coordination benefits verifications, right?
Right.
To maybe like kind of more operational and clinical together, which is like our AI scribes
Okay.
section, you might
Hmm.
say. And then there's like diagnostics, right? That it's looking, maybe it's like a stethoscope, a CAT scan, imaging of other kinds, where they're incorporating some kind of AI algorithm to interpret the findings of that particular diagnostic device. There's also a lot of like digital mapping of data points to creating digital twins. So there's a lot of different ways that people are using AI and digital tools today in healthcare.
Hmm.
I think things that have gone pretty well are the things that are very targeted. They
Okay.
do this one thing, they do it very well.
Right.
And so you could think about like a bridge
Okay.
started in like a very specific area. It was note taking, and they've evolved that quite a bit. And I think that like there's a lot of other ways you could think about like maybe Sword or Hinge, looking at using AI for physical therapy. You could also think about like maybe ecostethoscope, using
Yeah.
the stethoscope as a diagnostic device for a myriad of things that like you would not actually be able to use a normal
Yeah,
stethoscope
otherwise.
with.
Hmm.
And so I think like things that are very targeted and have a definitive use case are the ones that do pretty well. The
Yeah.
ones that are a little bit more broad and are like, you could apply this anywhere, kind of
Yeah.
end up getting applied nowhere.
Okay. Okay. Yeah, no, that's really helpful to understand. Yeah. Okay. So, yeah, starting to look ahead, there's a lot of room for growth, I suppose. How would you like to see AI and digital health evolve over the next few years? What do you think could change?
I think for digital health specifically, what I would really like to see, what I think is like very near and dear to my heart as a primary care physician, is
Uh-huh.
access to care.
Okay.
So I think there's been a lot of debate in the country over the last maybe even decade at this point about the lack of healthcare providers. And we see this trickle down in our healthcare system in a lot of ways. Number one is patient facing, like there's a huge wait times, right?
Okay.
Especially for specialists, but also even now for primary care physicians. We also see, especially in rural areas, that there's like just not really even access to care in person. We have seen this, I think, this conversation around like, hey, if we increased residency spots, if we built more medical schools,
Hmm.
like, could we close that gap? And I think we've reached a point where like that gap is really not going to be closed
Okay.
by just increasing residency spots at
Right.
this point. Like the gap is so large that
Hmm.
we do need technology to step in to try to scale care. I
Yeah.
think like because of COVID, we did see a push towards telehealth,
Yeah.
which was a pretty big disruptor in the industry. And I think telehealth is definitively here to stay. I think it's pretty widely adopted at this point, and I think that we have seen that that has been a really big boon for access to care. I think moving forward, what I would love to see is like how we can continue to push that, of not just being like, oh, telehealth is like you jump on a Zoom call with your physician,
Hmm.
but we start to incorporate like hospital at home, remote patient monitoring, wearable devices. Like, how can we bring these things that are in existence today as
Hmm.
separate, disparate technologies and bring them together to create a really comprehensive digital experience for patients that is as good as, or actually with the potential to be better than, in
Right.
person care, right? In
Yes.
person, you're only ever going to see your doctor like a few times a year. There's no chance you're seeing them every week, right?
Right. Definitely.
Um, and so I think like the ability to use digital technology to say like, hey, I want to track my data in real time. And not just track it, which we can do today, but like actually lift real and actionable insights from that data, um, and then inform like what an actual treatment plan should be for me as an individual is where I'm hoping a lot of our access to care conversations will end up, of like, how do we speed innovation in this area? How do we increase technology innovation? How do we use that to increase access to care so that patients who truly need to see a physician, who need to see people in person, who need to be have access to like in-person facilities, we are making sure that they're getting the right resources that they need. And for everyone else, let's make it as convenient as possible. And so I think like that's where I'm hoping to see things go.
Yeah, I hope to see that as well. That's really valuable. Okay, I have a few fun, quick questions for the end here. If you had to pick a book, a podcast, or a person that's influenced your work, what would you pick?
Oh, that is a really good question. I would say, as far as a book, um, Working Backwards is probably the one I've read somewhat recently that I will credit on this podcast. It's a book primarily written by some members of Amazon leadership
Okay.
about how Amazon works and how it thinks about innovation. And I think like taking that type of a framework and applying it to the healthcare setting is really interesting. There's a lot of like overlapping areas of like how can we take um, healthcare, which has stubbornly been a pretty like conservative, slow to move, slow to iterate
Right.
sector,
Uh-huh.
and bring on an innovation framework that would help it to move faster and actually meet the needs of the American people.
That's nice. I think I'm going to read that as well. Okay. And to wrap up in one word, the future of healthcare is
Right?
bright. Awesome.
Yeah,
Perfect. Okay, Carolyn, thank you so much for joining us today. I really enjoyed learning from you, and I know our listeners will too. So thank you.
absolutely. Thank you.